All right. Good evening, everyone. This is the Delaware County Board of Health, January 23rd, 2025 meeting, calling the meeting to order. We have in the room, we have Anne Marie and Ernie, and online we have Lily Higgins. At this time, I'm going to just make an announcement for, we had one meeting since our last Board of Health meeting, which was our executive session on January 9th, 2025. At this time, I would like to call for public comment on the agenda items. We have, nobody's online either, right?
We don't take public comment from online in person.
So we have no public comments and there is no one in the room. And then, so at this point, I would like to call for the approval of the minutes from our previous meeting. And so I need
Motion to approve.
Second, all in favor?
Aye.
Scratchy eye. Okay, so the minutes have been approved. At this time, we'll have director updates from Laura.
Yeah, that's right. Yeah, I just have two small updates. For the most part, I wanted to comment on DCHD's employee retention analysis. We've done some number crunching, and we talked about, that's a little bit, wanted to bring this before you. So for 2023, we had an average number of 81 employees over the course of the year. 2024 got up to 83. So there were some hires and some departures, and that's what it averaged out to be, very similar across the 2 years. But we were happy that the overall retention and separation rate was much better over the 2 years, where we had a 34% turnover rate in 2023 versus a 17% turnover rate in 2024. So it's just
great.
Happy to share that. I have more details about the number of hires and separations and finals, but that was the overall summary. So, the only other thing I wanted to comment on was, obviously we heard the news about Prospect Medical Holdings bankruptcy announcement. I think it was a Sunday ago that we got that news. So the health department is supporting the county in trying to get communications and share, collect concerns and answer questions from community members that they might have about this. So we activated our wellness line for that purpose, and we've been sharing social media alerts that you can call the wellness line if you have questions. We also created a landing page off of our county website that has some of the general information that we can share.
Have you had a lot of calls?
We honestly haven't. It's been a handful. So we continue to be available, and we'll continue to promote it, but for now it hasn't been very much.
Are you aware of any issues that have arisen? Any harm that's come to patients or the public or laboring mothers or,
No, I don't think we could prove that with specific case information. Those were my two little updates.
Thank you. And now we have our new business, and I believe, did you want to introduce Victor?
Yeah, I think Victor's pretty familiar to everybody, but we have our senior epidemiologist for the health department here with us. Come on up to the microphone. Actually, should I give? Great. And we wanted to keep the board to have a standing presence of the epi department to give you epidemiological updates. So Victor's going to provide that for us. Thank you, Victor.
Good. Oh, you got it. Yeah, it's because of the online thing.
Well, glad to be here. My presentation will be brief. It's just a little bit about hepatitis B, perinatal, trends in flu, influenza A, and RSV, and then a little bit about infant mortality, and what's really going on with infant mortality in Delaware County. So I think we can go to the next slide. Okay. This slide, the data that you're looking at, and I'm sorry about all the lines, but the data here It's collected from records, local records, on the number of mothers that are delivering babies, and they have a positive test for hepatitis B, perinatal hepatitis. So these data come from our records. This is not state data. And the important thing here to note is that compared to last year, 2023, in 2024, which is the purple bar, we're looking at an increased number of babies born from a mother with hepatitis B. Slight increase compared to last year. These lines that you're looking at right here, they only represent a decreasing trend, but only when you look at the first month of the year, January to December. That's what the lines are telling you. They're not telling you that the number of babies born from mothers with hepatitis B is decreasing. It's just the trend over month. That's what it is. I think the numbers on top of each bar is the number of babies born in each month. But the important thing is, if you look at the averages, it went from 2.4 in 23 to an average of 3.48 from January to October of 2024. And I think we can move to the next slide, please. Oh, can I do that too from here? Whoa, that is nice.
Hey, Victor?
Yes.
One thing on the last slide, one of the reasons why there's a slight increase in those cases that we're seeing is the state did change the reporting guidelines for these cases, and it's more sensitive now. So we are seeing an increase in things that we need to, cases that we need to investigate.
And I also want to take the opportunity to thank our nurse. Yes, thank you for helping me with this. Excellent, excellent. Because she calls the providers and the mothers to make sure that they are receiving the best care to prevent complications. As you can tell, this liver disease caused by a virus can actually create big problems, including cancer of the liver, and in some cases, premature death. Now, let's go to the next slide, which is, this one is about flu A or influenza A. Important take-home message here that the numbers this year on your extreme right on your screen, you see the bars are higher than on your left. So by the same time, the first week of last year compared to the first week of this year of 2025, look at 2024, you're going to see higher bars, higher numbers. So that's the message that it's increasing. And I also look at the Delco versus Pennsylvania rates. These are numbers, these are not rates, but the rates per 100,000 individuals, the Delaware County rates were statistically significantly higher compared to the state between the years of 2019 and 2023. That's a different set of data. But it points to the fact that we are having a heavy burden of influenza A in Delaware County. Now, if we look to the next slide, which I'm going to do, thank you very much. This is RSV. Yes.
I think that's important to note too is the high number of, in Delaware County, the high number of long-term care facilities that we have.
That is so true. And we have a larger number compared to other counties of long-term care facilities, assisted care facilities, skilled nursing facilities. And we do get quite a bit of calls to the call center. They report to us on a regular basis about outbreaks of flu, of RSV, and other noroviruses. But also, sadly, we also got reports from hospitals about flu A death. So yes, you're right. It contributes to that too. But when we look at rates, then we can normalize that. RSV, the story here is about basically the same, but this time not as bad as flu A. That is the main story. More cases in 25 again by week 1st of 2025, more cases compared to the first week of 2024. You can see that the bar is higher. Now, we're moving to infant mortality. This slide has two sets. On the right, excuse me, on the left is Pennsylvania, Black infant mortality rates. The number of times that the Black infant mortality rate is higher compared to white. So if you look at the first bar in blue, it's 2.45 times higher Black infant mortality rates than white, and so forth in the red bar, which is 2012 to 2016, and 2016 to 2020. And then finally, the purple one, 2020 to 22. So these time periods just showing to you something that is, let me see if I have a, well, now. What this is showing, yeah, is if you look at the Pennsylvania one, and then the Delaware County is one with the square, the blue square, look what happens to the bars from left to right. They go down in Pennsylvania, but look what happens in Delco, it goes up. So it tells us that the number of times the Black infant mortality rate is higher than white is increasing in Delaware County over time compared to Pennsylvania, which is decreasing. So I think that's a powerful message. Now, this is a little bit complicated. I know, story about that. But I love this. The colors here is just to represent periods of risk. This is a study, it's called the perinatal periods of risk, or PPOR. It was developed back in the 2000 to 2004, adapted from the World Health Organization by CityMatch, CDC, and collaborating state health departments, urban health departments. So it was adapted from the World Health Organization by them, March of Dimes too. Now, what this is different from infant mortality studies. Why? Because the perinatal period of risk looks at risk factors according to two measures: birth weight and age of death. And if you look at the colors, blue, kind of reddish, yellow, and green, when you look at the middle box where you see birth weight, then you see something called less than 1,500 grams and over 1,500 grams, and then you see the blue colors, and you're going to see fetal, neonatal, and post-neonatal. That is the age of death. So if a baby is born with, let's say, 750 grams of birth weight and died in the second day of life because it's less than the 1,500 grams, it will be attributed to the blue line, which is called maternal health and prematurity. And they gave those numbers to these categories for a reason that I will explain later. But keep in mind the colors: blue, pinkish, yellowish, and green. If the baby is born and weighs, let's say, again, 750 grams and dies with 20 weeks of gestation, so it's going fetal, but still goes to the blue. But if the baby is born with over 1,500 grams, then you need to put that count of that baby death either in maternal care, if it's a fetal death, neonatal, if it's 0 to 27 days, and post-neonatal in 28 to 364. So this is a way to analyze, to look at the data more closely and say, well, the number of babies that die with a weight of, let's say, 1,500 grams, this is the number of babies that die in white populations, white mothers versus Black mothers. And we then calculate the infant mortality rate and assign infant mortality rate to a specific period. Can be the blue one, maternal and health, can be the pink, maternal care, and you're going to see the importance of assigning the number of deaths to these categories. You're going to see why. So it calculates more closely these indicators, but also it measures the excess death between white and Black babies. That's very, very important. 3 type PPR studies have been done in Delaware County, 2 by the Foundation for Delaware County with those dates, 2008 to 2012. And when we say 2008, that means we include data from 2008, 2009, 2010, 2011, 2012, 5 years. So we need 5 years of data, enough numbers to have a reliable computation of rates. That's why we need that. And who says that is the method? CDMatch and CDC. CDC appointed an epidemiologist to develop these adaptation of this methodology. So that's what it is. And then I just put here why we look in fetal death at least 16 weeks of gestation and over. Less than that is not considered. However, sometimes we're going to increase that to 24 weeks of gestation. So it's a process to do what? To find out why more Black babies are dying and to look for risk factors, causes, and number 3, this is the best part, to promote a collective effort with partners. Then develop a community action plan to address those causes, those risk factors. That is the whole purpose of the PPR in a nutshell. So we did ours including data from 2016 to 2020. When we look at these data, we needed 2 things: births linked to death certificates. Why? Because there is information in those certificates that is not available in other vital record statistics. So we needed to look for risk factors, maternal complications, complications during delivery, complications after delivery, and what happens around during the time that the baby died. So that's why we need those type of information. What is the PPR Delaware County that we did in 2016, 2020 telling us? They're telling us a couple of things. Unfortunately, if you look at this slide, you're going to see the purple bar kind of higher compared to the orange and blue. Those colors represent years. So what I did, I compare the PPR project of 08 to 2012, 2012 to 2016, that's the orange color, and then 2016 to 2020, that's the purple one. So I compare all three PPR projects over time, and then I look at the period of risk. And remember, there are 4: maternal, health and prematurity, infant care, newborn care, and maternal care. There are 4 periods of risk of what? Of dying, of the baby dying. So when you look at this, you're going to see that the purple one is higher than the orange one in almost all of the 3 or 4 periods here on the upper left corner. And this is Black infant mortality by perinatal periods of risk. That's what this first chart is telling you. The second chart includes white infant mortality by perinatal periods of risk. And look at the difference. It is higher in the maternal health period, the first set of bars. Look at how it's higher. Then lower compared from the last PPR to the next one, to the ones that we did. It's lower, but it went again in the newborn care. And I'm going to explain why this is very important to know. And then it went down in the infant health. And when we look at the last chart, which is the one on the bottom, this is excess infant mortality death, excess Black death. And all of those perinatal periods increase when we compare the last PPR with the most current one, the one that we did from 2016 to 2020. So that the story that is telling us that is increasing the risk of death, the risk of excess death increased from the last PPR that they did. Now, if we move to the next slide, this is why all of this is important. Remember the colors? Blue, maternal health and prematurity. Pinkish, maternal care. Yellow, newborn care. What this is telling us, you see the arrow? These are the strategies that are recommended to address the problem. So here we have in the first set of, we have maternal health and prematurity, the blue one, preconceptional health, health behaviors, and perinatal care. We need to look at what we can do around these areas for both Black and white mothers, for both of them. When we look at maternal care, which involves prenatal care, high-risk referrals to proper hospitals, and obstetric care, mostly systems care, this is very important to look in Black mothers too. Now, when we look at newborn care, we need to look at perinatal management, neonatal care, specialized care, and pediatric care, and this needs to be looked at for both Black and white mothers. And the last one is infant health, and they talk about sleep position, SIDS, sudden infant death syndrome, breastfeeding, and injury prevention. So as you can tell, these are some of the recommended strategies to address the problem. The PPR helps us to find the root causes and then assign a infant mortality rate according to the period. By looking at the periods, then we can look at strategies to address those issues, those causes. The last slide, it's recommendations to reduce disparities in infant mortality between Black and white. This has been published and make reference by at least in 364 studies. And these are the basic areas that they recommend we consider when we look at collective efforts to address excess Black death. And to name just a few, provide interconceptional care to women before they get pregnant, during and after. Increase access to preconception care to African-American women. Make an effort on that, very specific. Improve the quality of prenatal care, and so forth. So these are the 12 points that are recommended by experts in this field, and most PPR projects, for example, the one that I helped to conduct in Chester County, the state Title V agency, the state Pennsylvania Department of Health requires as part of the funding requirement to use at least one of these strategies to address the reduction in excess mortality between Black and white babies. So it's a little bit complicated, definitely complicated when you begin to look at the numbers and the data, and extremely difficult to implement when you need to get the support from partners to work together, address systems, to training, change ways of providing care, and also work with mothers and families. So it's very complicated, but at least we have something that has been working in other places, and we hope that we can use knowledge from these experts and experiences. And that's about it. Any questions so far?
Thank you, Victor. And I want to give one other context to everybody that today is National Maternal Health Awareness Day. And so that was this report that Victor, thank you for you did all the deep thinking on this, and it was so much work on your part. I know with others on the team too, but really thank you for this.
My pleasure, my pleasure.
We released it today. So this is hot off the presses, and it was a little confusing for some folks when we talked about this. Well, you're talking about data from 2020. How is this so current? Why is this a new thing? And it's because it takes a big effort and time and verified data that have gone through quite a process before you can even do kind of PPR analysis. So it is a fresh report with a new look, with the most updated approach to this that we could do with the data available now.
Yes, and also we used 2016 to 2020 because we wanted to follow the trend. If we missed and jumped to 2018 to something else, then we're going to have a gap. So we wanted to do that. Now that we know how to request the data to the state has to provide the data. It's a formal request. Now that we know how to do it, the next one is going to be less stressful.
And we're deeply integrating this with the community health improvement plan work that we have
Yes.
ongoing at the department.
Yes.
You mentioned the community action plan. We're going to embed that in our maternal, parental, and infant child work group and our strategies, and work with partners on that.
I have a question. Thank you, Victor. So with the rates being so high in Delaware County around maternal infant mortality, I'm just wondering, were we able to tease out which of those, the maternal health or infant care, was the leading cause?
Excellent. Thank you very much. When we look at the highest infant mortality rate, it was in the maternal health and prematurity area. That means that we have to do what? We have to pay close attention to preconceptional health, health behaviors, and perinatal care. That's before, after, and before, after, during, and after. So that's excellent observation. And that was the same category that the other two PPR that were done here by the Foundation for Delaware County also said maternal health and prematurity had the highest infant mortality rate, period, compared to newborn care, maternal care, and infant health. So that is true. And by the way, Philadelphia have done PPRs way back then. The state of Delaware have done, and Allegheny County, Montgomery County. So we're not alone doing this, and we exchange information. And the best part of this, City Match, the people that created this for us in the United States, friends of mine. So we communicate all the time, and they help me to move through. So we have great, great partners, and definitely at the national level too with CDC and City Match.
So I'm just wondering, I think we talked about this a few meetings back, where the Latino infant mortality rate was lowest, but they also had lowest rates of accessing prenatal care, right? So I'm wondering, when we're thinking about solutions, and when you sent the study that you had referenced, it said the protective community factors were key, not access to prenatal care. Is that right?
Yes, that's the paradox that I think you're referring to, that mothers coming from, let's say, Latin American countries, no prenatal care whatsoever. They deliver healthy babies, normal weight, no problems. The problem is, as they live here for over time,
Right.
the next generation of babies, not the same. So and that's one way, sadly, to what has changed. It happened also with other diseases. People that moved from Japan to Hawaii, very, very healthy. They stayed in Hawaii for a couple of years. They begin to show signs of chronic illnesses just like everyone else. So sadly, that is the truth.
Okay.
Victor, does the data allow you to drill down at all geographically, like to what, kind of boroughs or townships within Delaware County are?
Yes, I believe it is. Yes, I try to, because when you provide the data request, you can request anything. They give you a list, including personal information, and I decided not to, but yes, we have the location. Let's say that we don't have the location, then we look at the census data, say, we're looking for women, let's say Latino women, 15 to 20, where do they live? We look at the most current census data and we just zoomed right there. But yes, you can get that data from the state.
Just to bring up, because it's just, I think, another reason why we have this program, but the doula program that the county's trying to do has been proven to help with a lot of the issues that you highlight in the
Yes.
report, especially for higher risk women.
Yeah, great program. My first daughter was born with the help of a doula, 1977. Huh?
Yeah, he was.
Look at that. Hmm? Doulas.
I have another question, Victor, about the Hep B, the babies born to mothers with Hep B. Did it say that the babies were also positive, or is just the mothers had Hep B?
The babies are treated with medication injections
Mhm.
to prevent them from becoming positive cases, chronic cases.
Okay.
I am not precisely aware if they develop, when they are born, they're tested. If they have a positive test, I will check that out. But regardless of your mother is positive, they're going to provide care, which is vaccinations, and then follow up to make sure that they don't develop any signs of hepatitis B.
Okay. And Laura, do you know if there's a treatment process for people with Hep B in the county who might not have insurance?
I think that that's what would go through, we would refer them to Chest Pen usually for follow-up and care.
Okay.
Yeah.
Are you talking about at the hospital level?
No, just for anybody in Delaware County who did not have insurance and had Hep B, if there was a way to get them treatment.
I see, yes. Well, most people get the vaccines here for hepatitis B, which is the best preventable way to prevent hepatitis B. Those that do not have insurance, we see them here.
Mhm.
At Chest Pen, not we at the health department, but
Yes,
yeah, we would
yes.
make that referral.
Thank you very much.
I have one other question.
Sure.
I know we were talking about flu, but the COVID numbers have been also going up.
True, true. Since it's not a reportable disease, I decided not to put it here. But you're right. COVID, especially the last 4 weeks, COVID and influenza and RSV
Mm.
up. Luckily, we're looking at a plateau. We're not seeing so many, but influenza keeps going up.
Norovirus, we probably have to.
We
Yeah,
got
or-
norovirus, yes, all over the state, Delaware County, and just when we needed more, we have Candida auris fungus, also causing a lot of problems in long-term care facilities across many counties in Pennsylvania.
In the schools too, right? Is it RSV that's?
Yeah,
The
one
schools?
good reason for missing school.
Mm.
We get calls from school nurses, and we coordinate what to tell the parents using data from the Pennsylvania Department of Health, information from the CDC and the Pennsylvania Department of Health. They have letters to parents, to school nurses, so we got that too.
Laura, so how does Victor's perinatal report inform the department, and what actions, do you plan from that, or is it too soon to?
No, it's not too soon. It's absolutely part of the discussions. Like I mentioned, that maternal, parental, and infant health is one of our strategic priorities for the department. So we have an active work group. It must have how many partners we listed off and working together, collaborating on that. And it's helped us inform the strategies that we're working on there, and sort of direct our efforts in kind of different ways. So it's reinforcing our existing plans and sort of helping us balance which activities and partnerships might be the most effective in addressing the risk factors that are in the report.
Will this become a standing report? Perinatal report?
Yeah, we do plan on continuing to do this report at 5-year intervals. I mean, I think it's
Oh, yes,
it's very
yes.
valuable.
Now that this is the second one that I have done, but every time requesting the data we got data that was not good. So I had to go back and say, look, this is missing, this is missing. So it takes time. Now we know what to ask, who to call, and it's going to be smoother. I have to tell you also that, that the Foundation for Delaware County have been working on systems like this, changing in system since the 2000 with the Healthy Start grant. This is a multi-million-dollar grant, and they have wonderful programs addressing all the risk factors. So they are a super partner, and they are part of the community health improvement plan of our group here. So I think it's good to have partners like the foundation.
And we're also going to have a meeting in March for the Maternal Child Health Committee to also have a presentation about this and some other strategies that the health department's coming up with.
Is there a plan to evaluate the impact of the work you do, so to see how trends are changing?
Evaluation plans,
Yeah.
looking like, yeah, yes, and that's actually a very active area of work across all those CHIP committees that we've dealt evaluation plans. They're in draft right now. Victor, I don't know if you want to comment a little bit on behalf of that.
I would love to. This is the favorite part, evaluation. So we're working with all the work groups, all the 3 ones. And this morning, I submitted an example of evaluation measures, tools, what to measure, why. The preferred way is to evaluate by goals and objectives. So we're going, let's say this is the goal. We have a measurable objectives. We want to know activities, inputs, outputs, data sources. How can you tell me or us that progress has been made in each of the objectives? This is where we're aiming for in the evaluation process. It's process evaluation and outcome evaluation. That is the best part.
We're building that framework right now. This is year 1 of the committees being in function,
Yeah.
and we're trying to influence things that are, many years worth of effort to even see any impact. So we're just starting. We do want to make this process and these measures that we're going to be evaluating and transparent. So I think we're having discussions about how we will share publicly how we're doing and how we're measuring.
Thank you.
Thanks, Victor.
you.
All right. I guess Max.
Yeah,
Oh,
Oh,
no, it's the communications.
the
business.
communications. yeah.
Yes. And speaking of illness, I'm sorry, our communications specialist, Matt Rankin, was due to provide this report. He's sick, I'm afraid. The illness affected his family. He's home on the computer if we have questions, but I'm going to walk through his slides for him. So if you remember, I think it was last December when Matt came and gave you a review of communications presence for the department over last year. So we're a little month late this time, but we're doing it for you now. Just want to run through how our social media accounts are doing, what kind of earned media that we were able to put out there, what kind of paid media efforts that we had, and some of the video production that Matt just really excels at. I want to give you some of those examples. So next slide. So you can see our social media accounts. We're seeing increases in followers and increases in reach. We're really happy about that. We know that this is where a lot of people get their information. So this just kind of tracks for you where we are. Facebook is clearly our largest here, but and our X account, we've just kind of got going this past year, so we don't have a comparison for you with 2023. Our top performing social media posts during Black History Month, we had a pioneer, Coach Elmore Hunter, that just really grabbed our community's attention and really was shared very widely. So you can see the statistics there. But I think our second most top performing post had to do with the launch of our public health kiosks. So we're happy about that too. All right, next slide. Here's an example of some of the earned media. So that's when, we didn't pay for it, but we recovered for what we were doing. And there was a lot of coverage on the Test and Go kiosks, our back to school backpack giveaway. That's that picture there on the left with all the crowds in Yaden lined up, all those families. It was really, really, really wonderful. Delco Revive, a program where we've been doing Narcan and CPR training, all those things that got some great coverage. Clean the Green was when the employee anniversary activity, we went out in parks and did cleanups. Our mammogram screening events, partnering with Jefferson, the Stolen Colon, when we had that set up in front here of Government Center, and some of our whooping cough statistics and information. The things we actually did paid campaigns, or we invested our grant dollars to get health education information out into the domain. We did an STI video, fact versus myth for young people that's shown in school sometimes. We've done our Delco Revive videos. The CHIP explainer, which is what is a community health improvement plan? And it's a short video that we put out during our kickoff event, and we really find people really like it. Then there's some of the other work we did on Delco Revive and Test and Go. Hopefully you've seen some of the bus shelters and billboards and so forth for all those things. So this is an example of one of the videos. I think we'll go ahead and run that when Sean gets click. And that's the machine outside our Yaden office.
These test and go kiosks will be a game changer for we believe these test and go kiosks will be a game changer for our residents.
We asked ourselves, how can we offer more than just COVID-19 testing? Take things to that next level and offer a variety of public health resources in a one-stop shop. They're fully automated. You don't need to wait for a clinic to be open. And they're 24 hours a day, 365 days a year. And we also have test strips, condoms, feminine hygiene supplies, and first aid kits. And I can't emphasize enough, they're all free.
There's nothing that is too late for.
Example of one of them. And the next one, the final one I think we'll share is our end of the year recap video. We showed this at all staff, and Rose said, yeah, you should show this to the Board of Health. So. I just really want to thank the board. This is, you're part of all of this that you saw. I mean, you're underneath, you're building us up and allowing us to do this work. And we're really grateful. Thank you.
Thanks, Matt. That were really good. I hope you feel better.
Thank you.
And then I also neglected to ask if there was any questions about the consolidated reports that everybody received ahead of time.
And I really, again, sort of like the end of the year video, wanted to point out that there's some nice end of the year statistics in there for different programs. Like for environmental health, we were able to talk about how each year ended, the percentage of inspections that we've seen, and how they really did some innovative work in that department to say, okay, how did these things change year to year? Now that we're getting older, we can start doing that. And I think it really demonstrates some of the things we've been able to accomplish.
Yeah, it was really impressive seeing those cumulative numbers. And
right? Yeah. Do we like to get, maybe it's too many numbers. We have to think about ways of how to make this more digestible and some for folks, but like the videos are an example, I guess, of ways to do that.
Lily, are you good?
Yes, thank you.
Oh, I'm sorry to make you talk.
I think that's all I have.
And no other questions from the board? Okay, and as there is no public here for public comment, we will move right to adjournment. And
Okay.
thank you all for being here today.